Um, we're going to start off with a little bit of chemistry. Anyone taking chemistry now or had chemistry? Okay, good, great. We're going to talk about some of the dental materials that we use are two parts. You have one part that's the base, the stuff that you need, and then you add a catalyst to it, and it causes a chemical reaction. So it's like two parts. And one kind of material that we use is alginate. And this is alginate right here that I put in here. It's powdery, it's kind of pinkish, and this is the base. And when we add water to it, the water is the catalyst. And we mix it up and it starts to turn purple, and then it turns pink. And then when you've had an impression taken, like some of you have had it taken at the orthodontist, they pile it in a tray like that and stick it in your mouth and take an impression of your teeth, and they let it set up. It takes 2 or 3 minutes to set up. So some of you have had that done before. We're not going to do that today, but we are going to take an impression of someone's fist. So do you want to do this for me? Okay. 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 Let me see your hands. Oh, beautiful. Thanks. Nice. I was hoping it would be a little chippy or something, but that's okay.
This one.
Okay. Yeah, let's use that one. Okay. Okay, so I'm just going to do this. If I had a little camera, you could see that when I add the water, the alginate starts to turn purple. Not all types of alginate do this. Some just stay the same color, but the kind we have turns purple. And we don't usually use this much when we take an impression of someone's mouth. So it's a lot easier to mix. But I want the fist one, we need a lot. Tell me your name?
Abby.
Abby, okay. So after I get this mixed up, I'm going to have Abby make a fist and just stick it in this gooey stuff until it sets up. It takes a couple minutes to set up. And meanwhile, while she's doing this, if somebody could find a small object like a coin, a cool coin, or a key, or something cool that we can take an impression of. Just see if you can find something in your bags.
I have my car key.
Yep, car key would work. Okay. Okay, Abby. Do your fist and yep, just squish it. Okay, now stop right there. This is gross. Yep. All right, I'm just gonna, okay, now stay really still while this sets up. It's fun to do. Sometimes people do this with their kids, little kids, you know, to get an impression of their hand. We'll set that up. And while you're standing there, I just want, this is another kind of impression material that we use. It's vinyl polysiloxane. And it has, you notice this has two barrels right here. One is the catalyst and one is the base. And this little thing is a mixing tip. And when you put that mixing tip on here, like this, and you squeeze the impression material on there, it automatically mixes it together so that, and then it starts the chemical reaction. So, shall we use your key? Okay, so I'm just going to press this, I'm going to squirt this right here on the desk, a bunch of it, and we'll take an impression of this key. So I'm just going to go like this, squish it down. It's kind of big. And we'll squish that down. And we want to leave this here for about 5 minutes. Okay, so we'll just leave it, we won't touch it. And it's still a little gooey. We'll do that, and then after that sets up, we're gonna pour up the impression. That's what we call pouring up an impression. We mix up, the plaster is the base, and then the water is the catalyst in that case also. So I'm gonna just add some water to some plaster and pour it in this impression that we made. And at the end of class, it'll be all hard, and we'll have a model of Abby's hand. So it'll be really cool. We'll be able to see her nails and the little wrinkles in her knuckles and everything. It's pretty cool. And if you're taking a tooth impression, sorry, I'm going to move around a little. If we're taking an impression of someone's teeth and then we pour up the impression, this is what we end up with. If you want to look at it, we could end up with a little model of someone's teeth. So let's see how we are. Okay, go ahead and pull it out. It just goes, pulls right out. Okay, so here's a cool model there. And now we're going to pour it up. So I'll add some. some here. And mix it. Have you ever made pancakes from a mix that you just add water? Kind of. That's what this is sort of like. Just kind of add the water. And after I get it all mixed up, I'm going to put this on vibrator. I have a little vibrator over here, and when I put it on there, it gets all the air out of it. The little bubbles rise to the surface so that we don't have any bubbles in our final model. We want it nice and creamy. We always make a mess too, which is okay. One fun thing about being a dentist, I was a stay-at-home mom for a lot of years, and one thing I did all the time was just clean up after my kids. When you're a dentist, you have a dental assistant, and you can make a big mess, and your dental assistant will clean it up for you. So, that's a fun thing. So this is a little vibrator. Put it on here, and if you could see it with the camera, you'd see the little bubbles coming to the top. Just like when you make pancakes. I don't know if you've made it before, you can see those little bubbles come to the top when it starts cooking. Same thing here. Oh, can you help me for a second? Can you hold this on here? And hold it, don't press it down, but hold it so it makes a lot of noise. Yeah. I'm just going to pour this in here. Yeah. The noisier the better. So it just kind of flows into place. Okay, now we'll just let this happen. This reaction, let me see if we do this. This is an exothermic reaction that with this, when you add water to plaster and it sets up and makes it hard. And what's an exothermic reaction gives off heat. So at the very end of class, when the plaster is hard, we'll take out the model of the fist, of Abby's fist, and it'll feel warm because the reaction will still be going on for the next few hours. The polyvinyl siloxane or vinyl polysiloxane impression that we're taking there, we use that sometimes to take a bite registration, and what we do is we just squirt some of the material onto the lower teeth and have the patient just bite into it like that. And so when we send it off to the lab to have some kind of appliance made, the lab knows how the top teeth and bottom teeth fit together. So that's one thing we use with that. Also, that impression, this hasn't been in anyone's mouth, none of this stuff has, so. But this is what it's like after it sets up. It's kind of rubbery. If you want to look at it and then just pass it around, you can feel it. And this is the machine, the little thing that I just showed you. If you've had a silver filling put in your mouth before, the material comes in a little capsule right here, and it's separated in the capsule. And so in order to activate it, you put it on this machine that's called a triturator, and it mixes it back and forth really fast, and that causes a chemical reaction to happen. So then you put the material in the tooth where you're putting the filling, carve it up and make it look really nice, and then it continues to harden throughout the day. So that when you mix it together, that causes that chemical reaction to happen, causes the two materials to come together. Another material is just some of the cement stuff that we use, where it has two tubes in there, and you squirt it out onto the paper, and then you mix it up. And when you mix it up, it causes that chemical reaction to happen. And then if you're going to cement something in your mouth, like a temporary crown, you put the cement inside, you stick it on the tooth, and then it'll harden over the next couple of minutes. It hardens up really fast. There's another filling material. If you've had sealants done before, the sealant material has photoinitiators in it, which is something, it's a chemical that's sensitive to light. So when you put the material in your mouth, you shine a blue light on it. A lot of you probably had this done with either sealants or tooth-colored filling. They put it in and then they shine that light on it. and you shine a light on it for 40 seconds and it makes it hard. It's really cool. It was discovered through the space industry. They were looking for materials that could withstand re-entry for their spaceships and stuff, and some of the materials are from that. And they also use this material to repair windshields. So they use clear stuff instead of tooth-colored, and then they shine a blue light on it to set it up. Lots of cool tools. Dentists like tools. And most of the tools are really similar to like tools that you use every day, only they're really, really small. So this is a small dentist drill. This is the little bird part right there, and this is the bird part on the big drill. The dentist drill really is like kind of like a paintbrush. That's what we do our work with, and you can, do your artwork basically. A sander. That's a normal big sander. This is the little tiny sanders that we use. If somebody like breaks off a tooth, you put some tooth-colored material on there, and then you can use this little tiny sander to smooth it off so that it looks just like a tooth and you don't even know there's a filling there. It's really cool. Screwdriver. This is a regular size screwdriver, and this is my screwdriver. That's a normal screw. This is a little dental screw thing that we use. Sometimes if people, like if they have lots of decay on one tooth and we have to just remove like one of the cusps of the teeth, the little bumpy parts, you can put a little pin in there. You can screw a little pin, pin or a post or something in there to give the filling material something to hold on to. Torque wrench. Who's changed a tire before? Yeah, okay. Do you know why you use a torque wrench? To tighten it? Pardon me? To tighten it? Yeah. It has to be tightened. You don't want to tighten it too tight or you'll break off the bolts. But if you don't do it tight enough, the tire will fall off. So, and it's the same, this is a little dental torque wrench. It's tiny, and we use it with implants. This is a dental implant. This is an x-ray. These are crowns. These are the roots of the teeth. And this is bone. This is your jawbone all in there. And with an implant, you just screw it down into the bone, and then you let the bone kind of grow around it so it's really hard. And then a few months later, you make a crown, like a fake tooth like this, and you screw it right down into that implant. And you use a torque wrench, because if you tighten it, it would be really easy to tighten it too tight, and you would dislodge the implant. But you don't want it. You want it to be tight enough so it's not going to get loose. So that's why you use a torque wrench. Yeah, you can use file. You can put a nail file here too. These are different files. This is a dental file, and we use these when we do root canals. And this is an X-ray of a finished root canal right here with those little white stripes down the roots. And these are the roots of the teeth, and if you can see little dark lines down the middle of the root, when you have a tooth infection, that's where the infection goes. It goes right down into those little spaces. Those dark lines are spaces. So when we do a root canal, we cut a little hole in the top of the tooth, and we take this file and we go down and clean out the roots like that. Just take out all the bad stuff in there, and then we squirt some disinfecting material in there, and then we put some special root canal filling material in there. So when we take an x-ray, it looks white. It looks like white stripes. So that's what we use files for. And we have all different kinds of like pliers that we use to extract teeth. There's one for every tooth. It fits exactly on that tooth. Take a lot of x-rays. This is a panoramic x-ray. This is me a few years ago. And these white things are crowns and fillings that are in my mouth. And this is the bone area where the roots of the teeth are, and down here. These are the jaw joints, and the sinuses are right here. So that if you have allergies, I don't know if you've ever had allergies and your teeth hurt, it's because the roots of the teeth go right up into the sinus area right here, and they have the same nerves. So a sinus infection or allergies or weather change or anything can actually make your teeth hurt. This is a panoramic x-ray of someone that has baby teeth. This person's about 8 years old. And these are baby teeth, and these are the permanent teeth behind it. And when these baby teeth come out, these permanent teeth will come into the mouth. It's pretty cool. These are the second molars, or we call them 12-year molars, and they'll come into the mouth when they're 12 years old. And this one we took by mistake, because the person had earrings on. These supposed to have them take off any metal things. And the bad thing about this, you see the earrings, but it has a little echo right here. This is a an echo. These lines aren't those lines aren't supposed to be there. So we would probably retake that. Occasionally, you'll see like a little thing right up in here when someone has a hearing aid on, and that's okay to leave in place. But earrings always just cause all these echoes all over the place. It's really fun to be able to make people's teeth look better. I'm not sure. I know Tom Cruise has had some really bad teeth issues in the past. I don't know if they did this just to make him look like that, look bad in the movie, or if his teeth really look like that. But he's had them fixed, and they look really nice now. We can make, go from here to here. Lots of fun. Take out bad teeth like that. A tooth like that is probably loose, and it's probably not there's probably not much bone that's holding it in there. So if he came in and wanted that tooth pulled, it would take about 3 seconds to pull it out. And he would think that I was such a good dentist. Some people need dentures. The funny thing about when your teeth are really bad and they're all worn out and decayed, or they're missing and you don't have teeth, your mouth closes too far. And it makes you look old, and it makes you look funny. So your mouth is just closed too far. When you put a denture in, it just opens up the bite a little bit, it fills out your face, and it really takes about 20 years off you. Anyone seen somebody without their dentures? It's scary, isn't it? Yeah, I remember seeing my grandfather. Yeah, it's pretty creepy, but they look a lot older, don't they? Their face just kind of caves in when they take their dentures out. But it's nice to be able to make dentures for people. It looks really nice. Types of dentist jobs you could have. You could work in public health, like they have a clinic here in Omaha, One World Clinic. Most dentists that work in a public health clinic do it because the government will pay their student loan off if they work in a dental clinic, which is a good deal because it's expensive to be a dentist. Dental school is really expensive. You still get paid well. Maybe not as good as if you were in private practice, but you still get a good salary, plus they pay off. So it'd be worth working in a clinic or something for a few years. Private practice is what I do. It's probably the most common, where I'm the owner and I'm the boss. I do all the hiring and firing. I do all the business aspect of it as well as the dental aspect of it. I'm the only dentist, and I have my hygienist, my assistant, and my office manager that work with me. And you have a lot of control over your career, basically, but there's a lot of responsibility too. If something's going wrong, you got to fix it. If you have an employee that's causing a lot of problems, you need to fire them and get a different employee. That's not so fun. But you could be an employee dentist. Like if you've seen Papillion Dental Care over near Walmart, there's a dental office there. That's a corporate-owned dental office, and they hire dentists to work there. And it's kind of a nice thing for a dentist, especially right out of dental school, if they can work in a corporate dental office for a while, just so they can see the flow of things, how the business works and stuff like that. And they don't have to hire and fire anyone. They don't have to, pay people. They just get a salary, or they get a commission or something. Military hires dentists. In the Air Force, they give Air Force scholarships, and you can they'll pay your tuition, and then you stay in the Air Force for 4 years. And they really good dentistry. I see a lot of people that are retired military, since we're in this area where there's a lot of military people. And the dentistry they've had done in the military is very good, really good quality. So you get good training in the military. And you don't have to worry about finding patients. You don't have to worry about any business stuff. You just do your work. If you get tired of working in people's mouths, you can always work for an insurance company or something like that. This is some field dentistry. This picture was taken a while back because they don't have any gloves or masks on or anything like that. But sometimes in the military, they have to set up portable dental stations. If they're way out, somewhere. This is a dental chair, and sometimes they have like a little portable unit, like a compressor unit, so you can run your dentist drill and things like that. So you get to do some interesting dental work in the military. Some people who do dental work for free, for charity, go places where they set up, like portable dental units in third world countries, and they do work for free, which is kind of cool. A few years ago, we did a Nebraska Mission of Mercy at Papillion South High School. We set up a bunch of portable dental units in the cafeteria there, and then we just told people ahead of time, we're just going to do free dentistry for a few days, and there are probably about maybe 30 dentists there doing free dental work. And people line up, first come, first serve, and we just used their portable equipment, and when we were done, we just packed up and went home. It was kind of fun. Some of the specialties: oral surgery, orthodontics, endodontics, root canals, gum disease, a children's dentist. Those are the official specialties of the American Dental, recognized by the American Dental Association. Be a Lego dentist if you want. I like Legos. Dentistry is a really good family job. Who wants to go to medical school? Anyone thinking about that? That's great. Okay. Medical school is great, and I don't mean to discourage you, but if you think about the family time you have to spend with your family, if you're hoping to have a family, dentistry is really good family-friendly career, because most of the time you can go home at 5 o'clock. You work hard, during those hours, but medical field, you put more hours in, which is fine, but if you want to spend more time with your family, dentistry is a really nice career. Family friendly. If you want to be a dentist in college, you should major in something like biology or chemistry, because there are prerequisites that you need to take before you go to dental school. And if you major in a science, you usually takes in those prerequisites. Prerequisites are like chemistry, biology. You do have to take a psychology class, and some others, physics. And usually with a science degree, you take those anyway. You have to take the DAT. That's a dental aptitude test. It's like when you go to medical school, you take the MCAT. When you go to law school, you take the LSAT. It's just like an entrance exam, kind of. And you just try to do well on it, score high. And when you send in your application, you have to send in your VAT score as well. And that a lot of that determines who they will take, if you score high. So dental school's 4 years, and then if you want to do a residency, you don't have to do a residency. Medical, you do a residency after you finish medical school. Dental, you don't have to do a residency if you don't want to, if you want to be a general dentist. I didn't do a residency, I just went right into practice. And if you want to go to specialty school, like be an orthodontist or something, that's a few more years after that. Just want to talk a little bit about dental school, just what it's like. And the first 2 years of dental school are pretty similar to the first 2 years of medical school. In dental school, the first day they give you this giant locker, because you have all kinds of gear that they give you, supplies, because you're going to be working in the lab doing different things. So they give you a really big locker, and it's usually full. You notice this is a dental school class, and you notice that the guys have ties and shirts on. At Creighton, they make you dress up to come to school because it's a working clinic. The women usually wear slacks and a nice shirt or something, but it's a working clinic, so you're working with the public, so you have to dress up, dress professionally. In some schools, they just have you wear scrubs. Creighton, you wear nice clothes, and then when you're working with patients, you wear a white lab coat like this, or a blue lab coat. First 2 years, you wear a blue lab coat, and then they have this ceremony where you get your white lab coat when you're at third year. It's a big deal. Some of the classes you take the first year are microbiology and biochemistry and histology and things like that, same as medical school. Different ones are like dental anatomy and dental materials you take in dental school. In dentistry, you have to educate your hands as well as your mind. And when you go to school, we're used to educating our minds. And when you do poorly on a test, you think, okay, I need to study harder next time. Well, you can't do that with your hands. Educating your hands, who plays a musical instrument here? What do you play? Guitar, okay. Did it take a while to get your hands to do what you wanted them to do? Yeah. It takes repetition with your hands. You know, you can try harder, but no matter how hard you think, you can't make your hands, you know, do any better. It just takes a lot of repetition to learn. Some things to work on if you want to learn how to educate your hands. Learn how to work on cars. That takes a lot of good hand skills. Learn to play a musical instrument. You know, like you know, it just takes repetition, and it creates new pathways in your brain to help educate your hands. You can do some knitting or handwork like that. In dental school, they recommend taking a jewelry making class sometimes in college before you apply for dental school. They have a lot of the same tools in jewelry making that they do in dentistry. So that, you know, that's kind of fun. There a lot in dental school. A lot of the guys made like wedding rings and stuff for if they were going to get married. You know, they would make their own rings in dental school. It's kind of cool because they have the equipment there to do it. You could do some art, take some art classes. Dentistry is like half science, half art. You're actually using both sides of your brain. You know, people say some people are really left-brained or right-brained. Dentistry is like both sides. It's pretty cool. First year dental school, you take a class called Dental Anatomy, and you learn what the teeth look like, each individual tooth. And it's an all-day class. Most of the time in dental school, you go in, like in freshman year, you go to the freshman lab, and you have your assigned seat in the freshman lab, and you sit there, and your teacher comes to you and teaches you for 50 minutes, and then they leave, and you have a 10-minute break, and then another teacher will come in and teach you for 50 minutes. And you do that from 8 to 5 most days. And you have the same seat, same classroom, so you don't have to worry, you know, that you can't find your class. And you have the same people in every single class. It's not, and you don't pick your classes. You say, okay, here's your schedule. It's like elementary school. They hand you your schedule and say, okay, this is what you're going to do on Mondays. This is what you're going to do on Tuesdays. And you don't have to sign up for class or anything. It's done. It's just the program. And on Mondays at Creighton, where I went, we had dental anatomy class, and it was all day from 8 to 5 with an hour break. And we would carve teeth out of little blocks of wax. And they would give us a diagram and say, they might say, we want you to make a maxillary first molar today, right side. And so they give us a little diagram with the grid work on there and all the little tools that we have, and we had to carve a maxillary first right molar. And you know, they turn out kind of like this. And that's how you learn the anatomy of teeth. And before you go to dental school, when you're getting ready, they ask you to collect extracted teeth, like from a local dentist. So you need to go around to the dental offices, maybe your personal dentist, and ask them if they would save teeth for you. And, you know, nice teeth, not ones that are all bombed out and gross. But, you know, sometimes people have to have teeth pulled for, anyone have to have a tooth pulled for before they have braces? You did, yeah, those would be good teeth to save because they're nice teeth. So these are some teeth that I saved from dental school. They're all sterile and good, you know, there's no germs on them or anything. And what we do is we mix up some plaster, kind of like that, put it in a little cup, and then put the teeth in there. And I'll pass it around if you want to look at it. It's not gross, it's perfectly fine. And then that's how we learn to do fillings and stuff. We just mount some teeth in plaster, and we sit at a desk and we drill the teeth like that. But in dental anatomy class, when we have a test, the instructor takes extracted teeth and makes like several stations, and he'll put like one tooth at a station, and you have to identify what tooth that is, like right, left, top, bottom, molar, premolar, incisor, you know, whatever it is, and you have to tell what it is, and you have to look at the little landmarks on there, and it's hard. It's hard. You kind of have to have some perceptual ability, which women aren't quite as good in general as men are, but you can still learn. There's denture lab, usually second year in dental school. This pink stuff is wax, and we work a lot in wax. We make like a little model there, and then we take some plastic teeth and we set them in the wax. So we use heat, This is like a little station, like a little desk station, and this is a torch, and it's like a little lighter, and you can melt the wax there so you can stick the teeth in, and then you have little instruments that you can get all the anatomy in there and stuff like that. It's kind of cool. And everybody has a Bunsen burner, and sophomore lab is notoriously hot because for 4 hours everybody has their Bunsen burner going full blast, and it gets really hot in that room. So, but you learn all about dentures. And this is kind of a typical lab. Where, you know, each one of these is a different station for a student, and there's hookups for your dentist drill. There's hookups for a Bunsen burner or whatever you might need in there, so you can practice. And that's where you learn how to, you drill on those little teeth that you brought to dental school with you, and learn how to do fillings. And then, I think I passed that around already. That's kind of what you get when you take an impression of someone's teeth. This person is making a crown out of this tooth right here. So that's one thing you can use a model for. And another thing, in first year medical school and dental school, you study gross anatomy. And that's gross, not like in disgusting, but gross as in large. Does anyone know what histology is? Have you taken histology? I never heard of it until I got to dental school, actually. But it's just the study of cellular structures. Like, you work through a microscope and you look at things that are like brain cells or skin cells or heart cells and things like that. If you're going to be a pathologist, you go to medical school and you study a lot of histology. It's the study of really small microscopic structures. Gross anatomy lab is the study of large structures, like the heart, the lung, the kidneys, the liver, blood vessels, and nerve tissue. And the way you study it is you dissect cadavers. This is a cadaver here. And a cadaver is a dead body that's been, usually, they say they get the most cadavers from people who are really poor and they can't afford a burial, so before they die, they will give their body, donate their body to science. So, and a lot of patients, people that have been patients at the dental school will, ahead of time, they'll donate their body to science. And so what we did is we had 6 students per cadaver, and we would study, the first half of the year we studied from the neck down. And we would dissect the cadaver, and we had to find all these different nerves and blood vessels. Anyone dissected like any animals or something in biology? A frog, yeah, okay. This is a little different. It's like a frog, only really big. It was when we first went to the class, our instructor told us that we had to treat these cadavers with respect because they are real people. They lived, you know, they had lives, and when we're working on the cadaver, we needed to cover the parts of the cadaver that we weren't working on with cloth. So you notice this one, the head is covered in cloth. So just, you know, just out of respect, basically. And when we were finished working on them, we had to wrap them up in this cloth and spray them down with formaldehyde. And we store them in these tanks, they call them tanks. And our cadaver was a lady named Jessie. She died when she was in her 60s, African-American lady. And, you know, they told us, if we wanted to know, they told us about who this person was, just so we recognize and appreciate the opportunity to actually dissect a cadaver. I mean, it's a big deal. But we would just take out the tank, open up the lid, there's Jessie, and we would do the dissection, and then at the end we just wrap it up again and close up the lid. And at the first day, everybody thought, oh, I'm going to pass out, I'm going to throw up, I don't know what's going to happen. And the teacher said that nobody has ever passed out, nobody has ever thrown up. And she even told us that we would get very, very accustomed to it. And it doesn't smell like a rotten person, it smells like formaldehyde, because all the blood is gone and they fill it up with, I don't know, something, embalming fluid or formaldehyde or something like that, so it just smells like formaldehyde. And your lab coat gets to smell like that way after a while. And before we knew it, when we had to study for a test, the way they did tests, it might have been the same with a frog, I don't know, but they set out the different cadavers and they would flag different structures with a pin and a little flag and a number on it. And you had your paper all numbered down and you went around and you had to write down what that structure was. And if if we were having a test coming up, we would find ourselves, we'd grab our lunch, we'd go to the cadaver lab, we'd pull out our tank and open it up, and we'd eat our lunch while we were looking at the cadaver and studying and everything. And she told us that we would be doing that. We didn't believe her, but it's true. You really get accustomed to it afterwards. The second semester in dental school, it'll be different in medical school. You probably just study the whole body, but the first semester we did neck down. Second semester we just did the head and neck, because in dentistry that's what you focus on. So they told us it's a lot easier to study the head and neck if you just cut off the head, and then you can just, you know, set it right there and look at the head. So they gave us a power saw and said, cut off the head right here. So what I like to do now is when I'm at a party or a meeting and people say, okay, we're, you know, getting to know you, tell us something about yourself that nobody knows. And I say, once I cut off someone's head with a power saw, and everybody goes, oh, a real person? Yeah, a real person. So it's kind of funny that you can tell them that you cut someone's head off. Okay, this is in dental school, this is a lab that has mannequins in it. It has, these are fake heads with fake teeth in them, and that's where you first learn, you know, the first fillings and stuff that you drill, you do on those little blocks that are going around. But then it's a lot different than doing it at someone's mouth. So you use a mannequin, and you have to sit there, and you do it upside down and backwards through the mirror, learning how to work through a mirror and stuff. Hi.
Looking for Mr. Curry's class? Yeah. 312. They're in room 312.
Okay. So the next step after working on the bench is to work on a mannequin before you go into the real into the clinic with the real people. This is another mannequin lab. Each unit is set up with everything you need. There's an instructor and there's a student, and you work with an instructor. And then you have to learn, before you go onto the clinic floor, you have to learn how to give someone a shot in their mouth. And the way you do that is with a classmate. You pair up with one of your classmates, and you take turns, and the instructor will come up with a big long Q-tip, and he'll come over and he'll say, okay, this is where you want to inject right there. So, it's not likely, you know, the only thing that would happen is that you don't get numb, and so that means they miss the nerve, something like that. But so you have to, in front of the instructor, you have to numb some upper teeth, and then you have to numb the lower teeth, because it's a different way for both. And it's scary. The person that's getting the shot is scared, and the person that's giving the shot is scared. And when you're laying on there, the person getting the shot, the one coming at you is like this with their hand shaking, you know, so it's pretty scary. And then when you go out onto the clinic floor, you have a patient there, and you have to numb your patient, and they're really nervous, and they say, have you done this before? And you can say, yes, but you don't have to say once. You know? You have to, you know, you've done it before. And it's getting nice and warm. Okay, so then you go out in the clinic. This is the Creighton Dental Clinic right now. And each one of these little units, you know, this is a dental chair right there, and here. This is a patient, and there's a student. There's a student with a patient, and there's an instructor. When you go to dental school, you have to know what procedure you're doing, and then you have to go get an instructor to come and kind of get you started. You say, okay, yes, you can start. And then you go and you do your drilling or whatever you're doing, and then you go get your instructor and they check it. And then you have to fill up your filling or do whatever you need to do, and then you have to get the instructor again to check it. And if you're going to do one filling, it could take you 4 hours, like all morning. Like when I do a filling now, it takes me about 15 minutes, you know, but in dental school it takes 4 hours. So we very much appreciate people who come to the dental school to have dental work done. You can have it done really cheap there, that's why they come to save money. But you don't save time, that's for sure, because it takes a long time. But it's interesting, and but it's hard. You know, they want you to work slow and take your time, and eventually you'll build up speed, but at first it takes a long time. If you went to Creighton Dental Clinic right now, they would send you to the pedo clinic, which is a children's clinic, because you have to be 18 or 19, I can't remember, in order to go to the adult clinic. So they see kids in the pedo clinic right there, and kid. And by the end of dental school, it's like, it's really hard. They tell you on the first day of your orientation, the first thing is that it's also very competitive. So you have to try to do really well in college and high school. And when they told us the first day of school during orientation, you know, they accept 82 students at Creighton, and they had 1,200 applicants for those 82 spots. So that's, you know, I was so excited when they told me that. I thought that, I mean, that's so cool to be able to get accepted like that. I had a friend who was determined to go to dental school, and he was in one of my classes at UNO, and he was having a hard time. It was second semester physics, and he said, this is so hard. And I didn't think it was hard at all, and I thought, this guy's never going to make it to dental school. He won't get accepted, he won't be able to do it. But he didn't get accepted his first try. So he kept going to school, and he got advanced degrees, and he tried again the next year, and he did not get accepted the next year. But he kept trying, and the third time he got accepted because he kept going to school, and he was very persistent. And now he's an oral surgeon. So, you know, if you want to go, you can keep trying. But it's really, I don't know, it's very rewarding. It's hard, but it's worth it. Now, Abby, right? I'm going to take this out. This is really warm right now. The plaster is hard. It's hard to take out. You have to kind of peel it away.